Sexually transmitted disease prevention. Sexually transmitted infections, sometimes called sexually transmitted diseases, are infections that are usually spread through sexual contact between people. They are caused by bacteria, viruses, or parasites that enter the body during sexual activity. These infections can spread through bodily fluids such as blood, semen, or vaginal fluids. While sexual contact is the most common way STIs spread, they can also sometimes be passed from a pregnant person to their baby during pregnancy or childbirth. In some cases, infections can spread through contact with infected blood or shared needles. Because STIs can affect many people and spread easily, understanding them is an important part of protecting personal and public health. Symptoms of STIs. Many sexually transmitted infections do not cause obvious symptoms, especially in the early stages. This means someone may have an infection and still feel completely healthy, which can allow the infection to spread without being noticed. When symptoms do appear, they can vary depending on the infection. Some common signs include sores or bumps in the genital or oral area, pain during urination, unusual discharge, or discomfort during sexual activity. Other symptoms may include swollen lymph nodes, fever, rashes, or lower abdominal pain. Symptoms can appear within a few days after exposure, but in some cases, they may take months or even years to develop. Prevention of STIs. Preventing sexually transmitted infections is an important part of maintaining good health. One of the most effective ways to reduce the risk is by using condoms correctly and consistently during sexual activity. Condoms can provide strong protection against many infections, including HIV, although they may not fully protect against infections that spread through skin-to-skin contact. Vaccines are also available for some viral infections, including hepatitis B and HPV, and these vaccines have significantly improved STI prevention. Health organizations continue to research new vaccines and other prevention strategies to help reduce infection rates worldwide. Risk factors. Anyone sexually active can be at risk for a sexually transmitted disease, but certain factors can increase that risk. Having unprotected sex or having multiple sexual partners can make it more likely that an infection will spread. A person who has previously had an STI may also be more vulnerable to getting another infection. Substance misuse, including alcohol or drugs, can affect decision-making and lead to riskier sexual behavior. Additionally, sharing needles when injecting drugs can spread infections such as HIV or hepatitis. Younger individuals, particularly those between the ages of 15 and 24, often report higher rates of sexually transmitted infections compared to older age groups. Treatment of STIs. Many sexually transmitted infections can be treated successfully with medicine. Bacterial infections such as chlamydia, gonorrhea, and syphilis are often curable with antibiotics. Some infections caused by parasites can also be treated with medication. Viral infections, including HIV and herpes, cannot currently be cured, but antiviral medications can help manage symptoms and slow the progression of the disease. Treatments for hepatitis B can also help reduce damage to the liver. However, antibiotic resistance in some infections, especially gonorrhea, has made treatment more challenging in recent years. Possible complications. If sexually transmitted infections are not treated, they can sometimes lead to serious health problems. Some complications include chronic pelvic pain, infertility, and complications during pregnancy. Certain infections may also lead to inflammation in the eyes or joints. In some cases, sexually transmitted infections can increase the risk of developing certain cancers, including cervical cancer, which can be caused by HPV. Due to the fact that many infections do not show symptoms at first, regular screening and early treatment are important to prevent these long-term health effects. Testing and screening for STIs. Getting tested for sexually transmitted infections is an important part of staying healthy, especially if you are sexually active or think you may have been exposed to an infection. Testing is recommended if you have had sex without protection, have symptoms, know your partner has or had a sexually transmitted infection, or have shared needles for drugs, tattoos, or piercings. Even if both partners test negative, protection is only maintained as long as no one engages in new risk behaviors. Sexually transmitted infections tests can be done at a healthcare provider's office, sexual health clinics, walk-in clinics, or local public health units. Some tests are reportable to public health authorities, which helps monitor community health. Testing usually involves answering questions about sexual activity, having a physical examination, and providing samples such as urine, blood, or swabs from the throat, anus, vagina, or penis. These tests can screen for infections like HIV, chlamydia, gonorrhea, syphilis, hepatitis B and C, herpes, and trichomoniasis. Healthcare providers may also check the genital area for visible signs of infection, and for people with a cervix, perform a speculum exam or a bimanual exam to check reproductive organs. Overall, regular testing helps detect infections early, allowing for prompt treatment and reducing the risk of passing sexually transmitted infections to others. It is an essential part of sexual health and responsible behavior. Myths and misconceptions about STIs. There are many myths about sexually transmitted infections that can lead to misunderstandings about risks, symptoms, and treatment. For example, men and women may experience different symptoms. Men often do not show any symptoms, while women are more likely to have noticeable signs, such as vaginal discharge, pain, or inflammation. Some people think you can only have one STI at a time, but it is possible to be infected with multiple STIs simultaneously, even without symptoms. Another common misconception is that all STIs can be cured. While infections like chlamydia and gonorrhea are treatable, others such as herpes and HIV are manageable but not curable. Some STIs, if left untreated, can also lead to infertility, particularly in women through conditions like pelvic inflammatory disease. Lastly, not all viral infections are exclusively sexually transmitted. For example, cold sores are caused by the herpes simplex virus, HSV1 and HSV2, and can be passed through skin-to-skin contact, not necessarily sexual intercourse. Understanding the facts about STIs helps reduce stigma and encourages safe behaviors and regular medical care. Conclusion. Sexually transmitted infections are a major global health issue that can affect people of all ages who are sexually active. Because many STIs may not show symptoms right away, they can spread without individuals realizing they are infected. Learning about symptoms, risk factors, and prevention strategies is important for reducing the spread of these infections. Practicing safer behaviors, getting vaccinated when possible, and seeking medical care when needed can help protect individuals and communities from the serious health effects of STIs.